What does informed consent for alprazolam, otherwise known as Xanax, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're going to be talking about Xanax. The generic name is Alprazolam, and this is one I've got requested multiple times. So Xanax is a benzodiazepine. So it's used for panic disorder and generalized anxiety disorder, and it's typically thought of as one of our benzodiazepines with a shorter half-life and duration of action. So typically it lasts about 4 to 6 hours, but of course it's going to depend on the person. And it is a lipophilic benzodiazepine, which basically means that the way that it gets processed in your body, the onset and offset are really rapid. So you may notice the effects within 10 to 15 minutes. And then similarly, as the effect is wearing off, you're going to feel that abrupt change as well. And so this can cause a couple of issues. So one, it's really reinforcing, which basically means that you have anxiety, you take it, and you pretty much immediately feel better. And so this certainly increases its risk of abuse potential, especially when it's used in combination with other prescribed or non-prescribed substances. The other issue is that because the effect stops so abruptly, it causes something called rebound anxiety, which is actually worse than the anxiety that you had before taking the medication. So this can make it, again, very reinforcing. You know, it feels good when you're on it, and then as soon as it's wearing off, you feel even worse than you did before. So you feel like you have to take it again. And so this gets people into a cycle of, if they're taking it every day, needing to take it multiple times a day, every day, in order to avoid that rebound anxiety. Now, there is an Alprazolam XR version, which has a longer duration of action. I haven't personally used this, but I've had people on this app tell me that it's been really effective for them. So if you do have experience with it, I'm happy to hear about it. And of course, side effects from the Xanax are going to be similar to all benzodiazepines. You can experience things like dizziness, sedation, impaired coordination, cognitive issues like memory issues, concentration issues. And even though it helps some people to feel more calm, for others, it can actually trigger irritability or disinhibition. And so some people basically have the opposite of the expected effect, and they can actually get aggressive. And then, of course, there's going to be things like dependence, where you become physically dependent on the medication. And if you don't have it, you're going to have withdrawal symptoms. Intolerance, which means that you need a higher and higher dose to get the same therapeutic effect. And the withdrawal from benzodiazepines can potentially be very dangerous and even lethal in some cases. So that can look like tremors, irritability, insomnia, anxiety, but it can also look like confusion, unstable blood pressure and pulse, seizures, and ultimately coma and death in some people. And that's the risk of acute withdrawal. But if you've been on this type of medication for years and years and you taper off too quickly, then you're also at increased risk of protracted withdrawal, which I've talked about in some of my other videos, but it basically can affect almost every system in your body: neurologic, cardiac, GI, lungs, urinary, you name it. And trust me, it's not something that you want. And we know that over time, the risk of having dementia, if you're on this type of medication, increases. And not only that, but with the issues with coordination, dizziness, there's an increased risk of falls, especially in the elderly. So this is not generally a medication that I initiate. If I want a short-acting benzodiazepine, I'm more likely to use something like lorazepam, which has a more predictable response in individuals and is much easier to taper off of. I've had people on alprazolam who literally no other benzodiazepine works, and tapering the alprazolam is near impossible for them. So I'd rather not get them started on something that I know could be a significant problem for them in the future. Of course, the risk goes down greatly if you're taking it only as needed, occasionally, but it's when you start taking it every day and or multiple times a day that risk really greatly increases. So typically when I'm prescribing this medication, it's because I'm continuing it from something they've been taking for years and years. And so I'm still going to have this conversation because it's important that they know all of the potential benefits as well as risks, so that we can make an educated decision going forward based on their goals and what is safe. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future offerings like resources or courses that I want to be able to communicate directly with you all about. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.